So, hi, good morning, good afternoon, good evening, wherever you are. Thank you for joining us and following us. So, please follow and put some likes because we need for YouTube now that we are YouTubers. So, today we have a very interesting case. I want to discuss a little bit about this case today. I don't know, no tengo retorno. So, recently I read a very nice paper and I didn't realize it uh, about the problems that today some lamps, luminal posital metallic stand, had or have with the distal part deployment, the failure of deployment that has been a situation that I believe has been passing in a lot of us that make therapeutic US. I believe that lamps has been the most advanced uh, device developed during the last 20 years because it opened the Pandora box to make new procedures, new therapeutic and minimal invasive procedures, and I believe that lamps needs and is very necessary to continue uh, to improve the quality of the lamps because I believe it's a problem with the manufacturer, right? So, but it's not the real situation because in the beginning, Exlumina that were the first company bringing to the market lamps and acquired after by other big companies. So it showed that they didn't have this kind of problem. So probably it's a situation that needs to call our attention. But regarding that, I believe, in spite of that, I believe lamps has, performed a lot of new techniques, and I believe in the new development, new improvement of lamps, because that will help us a lot to increase the number of procedures, of therapeutic US procedures, minimally invasive, and replace many surgical situations, surgical treatments. But today we have a case that is a ¿cuántos años tiene? Yeah, it's a 45 years old woman that came to our unit because of alterated anatomy. This patient have gastric bypass for lose weight. She's in a healthy situation right now in terms of her overweight and obesity. That is unfortunately it's a pandemic disease. But so so she came because of she had some complication during the procedure many years ago. So I believe no surgeon wants to go inside. So so I had this patient that had recently elevated bilirubin levels because of I believe right now is it was it was a migration of stones because you can see here on US a lot of microlithiasis and stones. I saw it. I have, I believe, one pictures here. You will see it in a few minutes. I will show it. This one. Yeah. So let me see. So you see here. You see the stones here and the shadows. Okay. So that's why now I know that this patient had microlithiasis, but I didn't have a very good window. You see the intrahepatic biliary tract is no. Necesito ver las dos imágenes. O rayos X en grande. So I decided to make a cholangiography through the gallbladder. So necesito ver la imagen en grande. Eso. Okay, so you can see here the biliary tract. The intrahepatic biliary tract is not dilated a lot. So very difficult to see where it was, and distant, from the left hepatic lobe. So we don't have access to the right hepatic lobe. Very difficult. So we are in one of the branch, and fortunately for this woman, I believe the surgeons left the gallbladder, in place, and I don't know if the patient had before the stones. I believe yes, probably, or it's because of the loss of the overweight. So in I was really thinking about the recall that had recently one of the companies, because of lambs, and I start to see it that I saw a lot of this problem of the distal flange even in a life in Hyderabad a few years ago, and this made me think a lot of the beginnings of Therapeutic US. So today, because of this, I didn't want to use lamps because of recall. We don't have like a good feedback in Ecuador right now. So I want to show you, and this was a discussion. It's still, well, it is strictly necessary to use lamps. I believe it's easier when it works fantastic, but because it's a single step and quickly pass, and then you can come back and be nice, be fine, But you need to remember that the diameter of the lamps is 10 millimeters, so you can have 15. But in this case, I am through the small bowel, I believe, and the risk of using a 50 millimeter, lamps or 10 millimeter lamps is still high. It's big. So I wanted to use today to show you the way that we performed it before, and it's an easier way also, and you can do exactly the same. So today I will use I just put it my quiero la imagen ecográfica en grande. I just put it my needle, and you see here, after the contrast, you see here my wire. This is very important, the wire here. So this wire is I always place the wire because I believe it gives me more, no, todavía no, more security. I'm not so good like some of my colleagues, and so this is the old-fashioned way to do it. But it's not also like a very difficult situation that you need a lot of time to do it. So I find out the best place to put it. You see here. You follow here. Yes, you follow here. Yeah. So when you do that, and when you are doing that, so once you pass the guide wire, you confirm that you are in the gallbladder. You see the X-ray. I have perfect, the gallbladder and my guide wire, inside. Second, I confirmed that right now there is no stones. There's no risk of more jaundice or cholangitis or pancreatitis because of there's no more stone in the biliary tract. But I have a good chance now having this access, and I will ask today just stent, metallic stent, partially covered. Why partially covered? Because I don't want that this have a migration. But I will come back in 15 days after the fistula is performed, and I will use just a small cystostom like this one, right? It's cheaper, and then I will deploy my metallic stent. So now I have perfect, see, and now I am inside, you see. Okay, empuja. Okay. And now I will pass a 4x4 metallic stent excuse me, 4 centimeter by 10 millimeter of diameter. So if you see it's the same diameter, and then I will put a plastic stand, because in these cases I believe it's much better because of the risk of movement of the bowel. So in that way I can be assured that there will not be a migration of this. And even if there is a migration, there is not a big problem. It's not a big problem. Could be a big problem just in the first, you know, 2 or 3 days, but after that I believe it's not, the risk is lower. Well, now I am inside. I pass the Miss Metallic stent. You see? And by fluoroscopy, I want that you see it. Necesito la imagen de fluoroscopía en grande. Fluoroscopía en grande. Okay, so now you see very well the stent. And I will start to open. Abre, por favor. Sí, un momento. Sigue abriendo. Okay, un momento. Okay, you can see now the stent is open. I need the US image. Imagen de ecografía, por favor. And you can see by fluoroscopy, so it's easier. Even if you want to do it without fluoroscopy, you can do it. Okay? Okay. Abre. So now I know that I am inside. Okay. So I will less my guide wire in place because I need to pass a double pigtail right now. Okay? But you can see now imagen endoscópica. You see, at least I will remove the sludge here. You see, very well. Okay, empuja. Ahora necesito un balón para dilatar. So I will make a balloon dilation. It's almost the same, you see? It's almost the same. You can see the stent is well placed. Okay, necesito la imagen radiológica en grande. So half of the stent is inside, the other half is in the is in both lumen. Yes. No, está bien. No, cualquiera. No, necesito 8, 9 y 10. Este es 10 milímetros. So I will make a balloon dilation until 10 millimeters because I want to pass the stent, the double pigtail. So in that way, you know, my question is it strictly necessary? I said maybe yes, maybe no. I don't believe. I believe it makes, you know, the procedures faster when it works well. But I believe now the safety of the patients is more important. In general terms, we need to understand that part. And and we need to see, you see how the sludge is coming, you see? Okay, no te preocupes. I believe I'm through the stomach. Gastric epithelium, the last part of the stomach, which is good. Okay. Okay. So you see my balloon? Okay, I will start to dilate, make a dilation, dilata. So these are the steps that you need to do it, okay? If you don't want to use lamps. And many of the GI therapeutic, so we start like that. Okay, baja, 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 okay. Sí. Bueno. Very good. You see? Now it's coming. The bilis is coming. So many people will say, why you are doing this? Let's say like that. Retira un poquito más la guía. Why you are doing this, you know, if there is no more stone in the common bile duct, but, you know, there is a lot of slush, not just the slush, it's the small stones that in each contraction that this patient will do it, each time that will eating or feeding herself, will make a contraction of the gallbladder, and the gallbladder will, you know, send the small stones or the slush there, and that's why she was doing cholangitis and jaundice recently. So this is the best way because, you know, the surgeon doesn't want to come back inside. Second, I find out a very good position in spite of the small stomach that this patient have. And third, I will remove the stones in 15 days completely and clean the biliary tract because I can go, you know, just by the gallbladder, sending sending a white wire, antegrade, and then, you know, dilate and cleaning in an antegrade way. So this is you know, just a small reflection that we need to do it. And congratulations for the paper. I believe we need to be very clear that we still need these devices, lamps, but for sure we need to make a recall, you know, a small call and attention to the companies that are manufacturing this, you know, that we need good products, cuidado. And that is why we make this environment. We say it, patients, industry, and physicians make this more efficient and more security, you know, because the cost of the lamps is high, you know, in comparison, you know, with the devices. However, in terms of cost efficacy, you know, I believe it's very good, and we will continue improve all these devices in the future. So, okay, Libera. You see, perfect. So now, you see, we have a perfect drainage. So I will diminish the risk of the patient of, you know, of make a jaundice again. Let me see. Fluoroscopía en grande. Okay, perfecto. So see you soon, and thank you for joining us. Make a like and make comments. I believe it's very important, the comments. Thank you. Bye. Cerramos.